Health literacy is just the ability of people to understand information that we provide to them about their health and about their medicines. We try to provide that in a way that they really understand it, often using pictures and other things. And we focused on a couple of different areas. One is improving the understandability of the informed consent process for our clinical trials, and the other is just improving the understandability for patients of our product label and the information that we provide to patients. Traditionally, we've thought of value as clinical and economic value, and there are standard ways to approach that. I think in recent years, the issue of affordability, independent of clinical and economic value, has become a concern of many people that, especially with many of the gene therapies and expensive medications coming to the market in the next few years, that it will break everyone's budget. And so we've started thinking about ways to assess affordability and to incorporate that into the assessment for overall value. The stakeholders for value and affordability have been primarily historically payers, which includes health plans and increasingly ACOs and integrated delivery systems. Comparative effectiveness research is head-to-head comparisons of real-world of interventions in real-world scenarios. I think the real-world scenario part has made it a little bit difficult for many stakeholders to embrace this, because traditionally comparative studies were done using good clinical practices, or GCPs, and in fact that's what the Food and Drug Administration and regulatory agencies require. But for real-world evidence, in fact, you can't do good clinical practices or GCPs, and that makes it really difficult for us to conduct these types of studies. One advantage of comparative effectiveness research is that it really informs the decisions that payers and patients have about the decisions that they're making, whether it's for a decision that a payer makes in terms of whether or not they want to purchase a drug and put it on their formulary, or an individual treatment decision with a doctor and a patient in an office to decide whether that's the best treatment option for them. Comparative effectiveness research, I think, will help patients make more informed decisions based on the evidence. And I think that will lead to better health outcomes for them. I sit on the roundtable for promotion of health equity and elimination of health disparities at the Institute of Medicine. That roundtable is comprised of people from various sectors who all come together and focus on these topics. And typically we will sponsor 3 or 4 meetings a year that are focused on a particular theme. And the theme might be improving diversity in clinical trials, which is a meeting that we did in collaboration with the FDA last year. Or it might be focused on a particular population. For example, we did about a year ago, we looked at how to decrease the rate of suicide among adolescents in Native American populations.